Thanks very much. Thanks, Franziska, for this kind invitation. As I told you before, I'm kind of an outlier because of several reasons. I'm a rheumatologist, and there are very few rheumatologists in the room. And going back to Chip's talk, I think rheumatologists are the ones who sometimes meet EDS patients, but we are not doing very well of recognizing them. So I think we have to do more. And probably I'm also the only person from Central Eastern Europe. I don't know if there are any members from our region in this society, and because of the financial reasons, also some lack of networking and everything, I think we have to do much better in Hungary, Czech, Poland, Slovakia, and I hope that's gonna improve in the future as well. So after a short introduction, I try to, as Franziska said, not only EDS, I myself is not an EDS person, but as a rheumatologist, we also see some rare diseases. I like to give you some case reports at the end because we are also practicing clinicians, many of us. So this is where Debrecen is. This is the second biggest city in Budapest, which seems quite interesting. But knowing that Budapest has 2 million people and we have 200,000, that's actually not a large city. It's about half of the population of Ghent. We are one of the 4 medical schools. And I show you, this is actually in a highly Catholic country. We are probably the only Protestant city. This is also called the Calvinist Rome. And we have the Reformed College founded by Martin Luther, and also Zwingli from Switzerland, of course, in the 16th century. So our college is was founded in the 16th century, and this is the Reformed Protestant big church, and I think that's interesting. That is the main building of our university, which has 13 faculties, and one of them is the medical school, and you see the 3D how our campus is looking like, and this is in the upper region, right picture shows our department of rheumatology today with the immunology. Now, of course, most people talked about the EDS classification. From the point of view of rheumatology, we have some forms of EDS included or associated with rheumatology, so I would rather give you a list of the rare rheumatic and musculoskeletal diseases, because many of the EDS cases had nothing to do with the musculoskeletal system, while others do. And for instance, this is the list with all the genes involved. So we also have a genetic center, and therefore the very few EDS cases we might have, I mean monogenic cases, are also diluted in a number of other diseases. But we are very proud because in Hungary, Debrecen has the only department of rare diseases. So rather than having, every single department might have their own rare disease programs, we have one major center, a rare disease program with a leader, and of course there is a network within the university. And in addition to the monogenic and inherited diseases, we also very much interested in the storage diseases. So we have about 9 or 6 Fabry and around 10 Gaucher cases, and that is also, we have a colleague who is an expert in that, but is also treated in a network. And sometimes, as you know, Gaucher or hemochromatosis or Wilson's might also have arthritis and other musculoskeletal diseases. So therefore, rheumatologists should look out very closely to find these. Of course, I was very happy to see the very recent nosology of genetic rheumatic and musculoskeletal diseases. This is also the other way around. That was published this year, actually, and that shows the 41 groups of diseases with about 2,000 different disease forms. And I try to put which groups contain actually EDS and related diseases. Like group 4 has the musculocontractual type, group 5 has the spondylodysplastic types, which we might see in rheumatology, and group 13, and that, of course, group 26 is the osteogenesis imperfecta, and group 31 is the Marfan syndrome. But if you look at those tables, there are 100 pages of this paper, and over 100 pages they show all these tables with all these 2,000 different forms. So I think we are getting harder and harder, but finally this very recent classification, and these 2,000 forms all include either the bone or the joints or the muscles. So it's definitely something to do with RMDs or rheumatic and musculoskeletal diseases. And this is actually was about an alliance partnership of bone rare diseases, and this has nothing to do with EDS, but I thought that what they found might be followed also in the EDS society. This was a nice group of people who had questions, put together almost 1,000 questions, which needs to be researched. And I'm going back again to Chip's talk, why research is so important. And after a certain algorithm, they actually picked 10 very important questions how bone rare diseases should be followed. So I recommend this also to be used for other rheumatic and musculoskeletal diseases. It's all about treatment. I'm not going to read it, of course, and also patient care and also prevention, prognosis, and everything. And I think this is a nice workup how you actually approach this kind of rare disease, in what is needed and what kind of research has to be done, and even with osteonecrosis and other diseases, we don't know too much about that. Now let's talk about a little bit about the network. So as I told you, we have 4 medical schools, one in Budapest, one is Debrecen, one in Szeged, and one in Pécs. And these are the 4 ones, and all of the 4 consist of some kind of a rare disease research, either a genetic department or a rare disease department. And so this is actually our network, and outside these 4 universities, there might be some other centers who are included. And I think in Hungary, if you take the definition of rare disease as a disease which affects 1 person out of 2,000, then we have 800,000 patients with all kinds of rare diseases. These are not only the rheumatic and musculoskeletal diseases. We also find what you find in the EDS, that we have sometimes, of course, delays for years. There is no treatment for most of the rare diseases. Of course, we heard that there is something on the horizon. And of course, half of the diseases occur only in adults, and this is very difficult because when you are a newborn, of course, you see it immediately, but sometimes not only with the EDS or Marfan's, but with other diseases, we see that these patients with Gaucher's and Fabry's also have a delay of like 5-6 years at least for the diagnosis, because nobody cares and nobody thinks they have these diseases. And of course, the treatment needs an individual approach and lots of money. And now the gene therapy is coming to life. It's really a big problem because right now the most expensive biologic or the most expensive non-genetic treatment would be 100 times less expensive than one gene therapy. So I think I told Francisca that we probably have about 15 patients with SMA and 2 patients with Duchenne's only treated with gene therapy. So it's just coming into mind, and we don't know where the money will come from, because the insurance companies would pay for a treatment for like 10,000 euros or something, but not for one which is even more expensive. Now, of course, there are leaders, of course, and there is a centralized national center for rare diseases in Budapest, headed by Professor Molnár, who is a neurologist. And she also takes care of the organization, takes care of the funding as well. So actually, these 4 people and some other peoples, together with the Ministry of Human Resources or Ministry of Health, and also the insurance funds, they decide which patient gets the treatment and who doesn't. So it's always an individual decision, unfortunately. So even if you guys have all the data, you have all the protocols, you have everything, every single case of a treatment, even with Gaucher or Fabry or any kind of gene therapies, has to be decided by this board, because they know where the money comes from and where it would be going. And these 4 experts from the universities are actually just giving advice, but unfortunately, the Ministry of Finance will decide who gets the treatment eventually. I don't know how it goes in other countries, but sometimes it's very difficult to convince these people who is giving out the money to give it. And with SMA, we had a great success now because, as I said, 15 patients already got the money, but that's also like 2,000 euros a piece. At the University of Debrecen, in this Center of Rare Diseases, or the network of rare diseases, we have 8,000 patients, and there are 4 or 5 groups who are member of the ERN. One group is member of the clinical genetics part, the Metaburn. One is a member of the EuroBloodNet. One is the pediatrics. One is the dermatology, and one is the gastroenterology. Rheumatologists are not part of this system, and Professor Figler is the leader of this. He is the head of the Department of Rare Diseases at our university, and this is the group of people, dermatologists, neurologists, gastroenterologists, hematologists, who can refer patients, and they have direct connection with the ERN, but also through Professor Figler, and I got some of the slides from him, and many thanks for that. This is our department of rheumatology. Of course, we usually just treat autoimmune and other rheumatic diseases, very few rare diseases. It's much better for us if anybody comes with that kind of disease that we refer them to this group of rare disease department, and we do the consultation from them. And there is also a very good thing that one of our colleagues, a rheumatologist, actually moved to this department of rare diseases, Boglárka Brugos, who is an expert in both rheumatology and rare diseases, so she's a kind of a bridge or connection between these two parts. And of course, I just show you very quickly some cases. There's no way I don't show a Marfan's case in Ghent, because it's all coming from Ghent, and we also use the Lois criteria, and this was one of the young guys with the fibrillin gene mutation of Marfan's syndrome. And of course, we have very few cases of EDS, and this is one patient of Professor Figler, just showing the pictures, because you know, of course, a lot more of these diseases than I do. So I would rather show you some other types of rare diseases, which is nothing to do with monogenic. And this was, and these are also very important to understand why communication with the patient is important. This was a very young female who had polyarticular juvenile arthritis, and she got anti-TNF therapy, and she did very well. And this is the standard therapy for JIA. But somebody told that alternative therapy would be much better, and your biologic will kill you. So she stopped the biologic and went to an alternative treatment, and disappeared from us for about 3 years. And in this situation, she developed amyloidosis. Amyloidosis is a very deadly, very severe consequence of chronic inflammation. If you don't treat chronic inflammation early enough, then amyloid deposits, which is, you can see it here, that actually these are small pieces of serum amyloid A proteins, which is deposited into several organs. It is deposited into the kidney, as seen here in the polarized light, and it's also deposited in the heart. And so when this lady returned after all, and we tried the biologic again, it was too late, and she died of nephrotic syndrome very early. And so it's very, very important that information goes there, medical treatment goes there, and the communication with the patient was very important, and we were very sad that she didn't come back to us. Of course, also in oncology and rheumatology, there are some very interesting or very sad or very rare cases. This was a synovial sarcoma, which is 1 out of 1,000,000. And then this was a young female who had a lump on the neck. You can see it on the MRI scan. And of course, there is no genetics here, but these kind of stainings. And finally, of course, there is genetics, sorry. The fish confirmed that there is a monophasic synovial sarcoma grade 3, and she got some checkpoint inhibitors, but eventually, after 2 or 3 courses, it was not effective enough, and this patient also died. And this was also a very interesting musculoskeletal case with lots of lumps around the vertebral area in a 68-year-old male, and it was also infiltrating the lower ribs. First, they thought it would be a metastasis of cancer or something else, and the biopsy suggested a rheumatoid nodule because the patient also had arthritis. But eventually, with all these stainings of the neuroendocrine sclerodermal origin, and the schwannoma and rhabdomyoblast activation, it turned to be a malignant peripheral nerve sheath tumor called MPNST, which is a similar, very, very infiltrative tumor, just like rhabdomyosarcoma, and this patient also died. And since then, I think there are only very few MPNST cases in the literature. And finally, I show this Gorham-Stout syndrome, which was very interesting because, of course, it's a known disease with these skull lesions without malignancies, and this is actually kind of a lymphangiogenosis and a vascular tumor, but it's not malignant, and it was, of course, not treatable by interferon alpha, and eventually there was a huge mass shown by this arrow in the intraorbital lesion, causing visual and compressing the optical nerve, and the patient was treated with bortezomib and thalidomide. But what might be most interesting for you that this group, Professor Fiegler, described this new mutation in the endoglin gene, which was a replacement of valin to isoleucine at the 568 locus, and this was not described before. So, of course, Gorham-Stout can be associated with several mutations, but this was the first when the endoglin gene, endoglin is also a TGF-beta receptor actually, and that is also an adhesion molecule, and it also binds some of the matrix molecules. So if you have, and endoglin is also an angiogenic marker. We showed it when I worked in Chicago. So endoglin is very important in adhesion and in matrix reorganization, and if you have a mutation like this, then angiogenesis blows away, just like in cancer, and you will have these lumps everywhere. So I think this is not so important now. So as a conclusion, of course, we have several definitions in life which might not be true. For instance, you may not know that French toast is actually not French, and white chocolate is not chocolate. Of course, Belgian chocolate is chocolate, and Danish pastries are not Danish, and guinea pigs are actually neither pigs, and they are not from Guinea. The only important thing is that rare diseases are not rare. So you have to look out. Thank you very much.